So you've probably heard about bipolar disorder.
You probably said to your friends before, "Hey man, stop being so bipolar."
But that's an inaccurate use of the word.
Bipolar disorder is a mental illness that consists of two phases, manic and depressive.
Which is why it's also known as manic depression.
Manic phase is characterized by agitation,
Little need for sleep,
inflated self-esteem,
reckless behavior like drinking binges, drug use, promiscuity, and spending sprees.
and bad temper control.
So basically when they're in a manic state, they feel like they're invincible and like they have boundless energy.
Sounds like a good thing. I'm king of the world! But actually, it can get them in a lot of trouble and takes a toll on their relationships and bodies.
No sleep. The flip side of mania is depression, which is characterized by difficulty concentrating,
Eating disturbances like losing weight or overeating,
loss of self-esteem,
persistent sadness.
and withdrawal from activities that were previously enjoyable, and friends.
Not much is known about bipolar disorder, but what we do know is that it's a chemical imbalance in the brain caused by neurotransmitters.
So in case you don't know what a neurotransmitter is,
It's a chemical substance that is released at the end of a nerve fiber by the arrival of a nerve impulse.
it diffuses across a synapse in the brain, which causes the transfer of the impulse to another nerve fiber, muscle fiber, or some other structure.
Some studies suggest that high or low levels of certain neurotransmitters such as serotonin, norepinephrine, or dopamine is the cause.
In class, serotonin controls mood, emotion, sleep, and appetite.
So without serotonin, it's hard to regulate moods. It can lead to insomnia and overeating.
Norepinephrine works side by side with adrenaline to give your body sudden boosts of energy. It can also pass nerve impulses from one nerve to the next.
High levels of it can cause mania.
Dopamine controls our brain's pleasure centers and helps us see and go towards rewards.
Look. So class, low levels of dopamine can lead to addictive behaviors, like excessive spending and promiscuity.
Incorrect levels of these chemicals cause the symptoms of bipolar disorder.
So although we don't know exactly how they work, we know that they have something to do with it.
Other studies indicate that an imbalance of these substances is not the problem, but that a specific level of neurotransmitter is not as important as its amount in relation to the other transmitters.
The most common treatment for bipolar disorder is lithium carbonate.
Whose chemical formula is Li2CO3.
And the history of lithium, well, that's eventful.
First of all, you should know that lithium carbonate is an anti-manic
Antidepressive.
and antipsychotic.
Lithium is in the alkali metal group, and its chemical symbol is Li.
Carbonate is a polyatomic, and it's a combination of one carbon atom and 3 oxygen atoms.
Despite being used for treatment, we really don't know very much about it.
It was first used in the 1870s to treat depression.
People were just kind of like, I don't feel well, and doctors were like, eat this, and then they felt better.
Except they didn't. In the 1940s, the FDA banned the use of lithium because of fatalities.
Severe side effects of lithium carbonate include severe allergic reactions,
Swelling,
blurred vision,
confusion,
excessive weight gain,
seizures,
persistent and severe nausea,
involuntary twitching or movement,
and lots of other equally nasty stuff.
But then, in 1970, the FDA put lithium carbonate on the list of approved medication.
While we might not know exactly how lithium carbonate works, we know it prevents relapses in mania and depression.
In 2004, a group of psychiatrists formed a study to analyze separate experiments comparing bipolar patients on lithium with bipolar patients on various other medications to test the efficiency of lithium in preventing relapses.
These studies ranged from 1973 to 2002.
In 1973, the participants were patients with manic depressive disorder.
They were treated in two groups, one with lithium and one with placebo.
1982.
Lithium, divalproex, and placebo.
2000.
Lithium placebo and lamotrigine.
2002!
Lithium placebo and lamotrigine again.
The results were, in the 5 randomized controlled trials, lithium was, in fact, the most effective in preventing relapses.
So yay, now we know that the chemical we're injecting actually works.
Bipolar disorder is no fun.
But it's important that we continue to do research so that we can help people who have it.
They're normal people just like the rest of us, only with a chemical imbalance in their brain that keeps them from living normal lives.
Class, we'll see you on Monday.